So today we're doing this safety plan that we are going to create together. So the goal of this safety plan and doing these activities is to provide you with the resources you may need to manage your anxiety and to also support your well-being. So to begin with, stress is a normal part of our daily lives, and we need some level of stress to carry out some daily activities. However, with too much stress, sometimes this can lead to other emotions, such as, feeling tired. Our bodies may feel tired. We may feel tense, or we may not be able to feel calm or relaxed. So today we will do this plan together, and this will be a plan that you will have for when anxiety starts to become overwhelming. This plan is something that you can use. It will have the tools you will need for when you start to feel that anxiety or that nervousness. So I will help you through this process with the safety plan, and then over the next few weeks I will check in with you, okay?
Okay.
Just to see how you are doing and to see if we need to make any changes to the safety plan.
All right. Yeah, that sounds good.
All right. So the first thing we are going to do is think about how you know you are starting to feel that anxiety. So right now I want us to think about what happens to your mind, what happens with your behavior or your body when you start to feel anxiety. So right here in this section, I want us to identify some warning signs. These are signs when you start to feel anxiety. So we'll identify some signs, okay?
Okay.
All right. And here you can write your signs right there.
Do you mean kind of like the thoughts I'm having, or like how my body feels, or like signs?
Yes, this can be what goes on in your mindset when you start to feel that anxiety. It can also do with your behavior, how your body reacts.
So some of the things I put down here is just like, sometimes I'll notice that I'm getting lesser sleep. Like I'll have a hard time falling asleep, or like, I'll wake up really early or something. And that's really hard, because then it impacts my next day, how like it's hard to be at work. And then I'll get kind of stuck in my thoughts, and it's really hard to focus, like especially with like, work and everything, and it's like, those are some of the things.
Okay, so what you're talking about, those are warning signs that you start to experience when you have that anxiety. So whenever those warning signs do pop up, you're now aware of those. You see that those those signs do appear when you start to feel anxiety.
Okay.
Okay, so it is normal to experience these difficult feelings, but sometimes when you are feeling that anxiety, there are some things that we can do to take our mind off the problems. So what I want to look at now is our next section B. So these are things I can do to help take my mind off of things. So with this section, I want us to think about activities that you like to do, that you have control of. So what are some activities that you can do to help take your mind off of things?
I really like running. I feel like that is being out in the nature that's always good for me. So there's that. I like to read sometimes. So just the same thing, you kind of get lost in like that world of the book. So I like that. And then my mom taught me how to do like beading, like with hex beads. So I do like little like earrings every now and then, and it's weird because then I'll use my hands like anytime I use my hands for any kind of activities, right, kind of like I get zoned in on it, and so it's like it's weird how the thoughts just kind of dissipate.
So right in the back of our safety plan, we offer different things such as taking a nap. That's something some people love to do. Sitting in the sun, going to the movies. These are just some ideas that you can also add to that safety plan as well.
Oh, that's a lot.
Yeah.
Can I go through it and like mark off which ones?
Yeah, if you want to. These are just different items that you can also do.
Okay.
Any new hobbies you want to develop as well.
Okay.
So now that we've gone over activities that we like to do that can take our mind off things, we'll move to our next section, which is my support people. So with this section, I just want to let you know that there are many people in our community who care about you, and we can reach out to others in our community. So with this section, I want us to identify people that can help you and distract you from the things that bother you. You can provide 2 support people. Here we have the names and phone numbers. And let's take a moment to think about who these support people could be.
Okay.
You are allowed to put their name and phone numbers right here.
Okay. Yeah.
All right, so we identified 2 support people, which is your partner, Cody, and then your dad, right?
Mm-hmm. Yeah.
Okay, all right, and then you provide their phone numbers. So these numbers will be for you to have. So this coping plan you'll be able to keep, and you'll be able to look back on those numbers, okay?
Okay.
All right, now that we identified our support people, the next section, we'll focus on places that we can go to take our mind off things. So with this part, I do want us to identify some places that make us feel better and take our mind off the problems. We could identify 2 places. So let's take that moment to identify those 2 places. This can be anywhere that you can go to. It can be like a spot in nature. It can be a relative's home.
Mm-hmm.
So let's take a moment here to identify 2 places, okay?
Or I can put my parents' home. I like going there. They're just always available to kind of talk to me if I ever need someone to talk to. So definitely my parents. The other, I like to get out in nature to kind of get my mind off of things. So I'm going to say the canyon right here, the Canyon de Chelly.
Canyon de Chelly.
Yeah.
That's great to hear, though. I really do like that you have your parents, that's someone you can go to.
Mm-hmm.
And, just being in the comfort of your home.
Mm-hmm.
And then also the canyon, you get to enjoy that beautiful sight.
Mm-hmm.
That is one of the landmarks here on the Navajo Nation. So that's really great to hear as well.
Yeah. Yeah, thanks.
So with our next section, we'll look at professionals and service agencies that we can go to for help during a crisis. Mm-hmm. And here I have a resource card that we provide these different services as well as departments for mental health in the Taylor Clinic or the Taylor area, the Chinle area, and the Pinyon area. Mm-hmm. So when looking at this card, we have also our National Suicide Hotline. Mm-hmm. We also have our Chinle Pediatric Department, our counseling services at Pinyon Clinic, Chinle Hospital, and Pinyon Health Center. Mm. So we can look at that, and when we go over, we can identify some of these resources that you would want to put on your coping or your safety plan.
Mm. Okay. I didn't know they had that. That's cool. Okay. Yeah, I want to add a few of these.
Okay. If you have questions, we also have our national hotlines as well. Okay. So now that we looked at professionals and service agencies, let's look at our next section, which is making the environment safe. So with this section, if you feel like you are in an unsafe place, there are some immediate steps that we can take to make you feel safe. This is where we can move to a safe location or talk to someone you can trust for help, okay? Mm. So we'll visit our guide and write down our safety steps. So at this moment, is there anything in the household that makes you feel unsafe?
Well, my partner, he has a gun that, I don't really agree with it there, but that is, kind of makes me feel uneasy. And then grandma, like she has some pills that she takes, and she has a lot of it. So, with the, kids in the house also, like, it just feels, it's, I don't know. She just kind of just leaves it out sometimes. Yeah.
Okay. All right. So what are some steps that we can take to make this feel safe? Is the gun in a safe place?
Probably not. It's just kind of like right there in the closet.
And are you able to lock that closet or put it up higher where the kids can't
I don't have anything to kind of keep it locked up.
Oh, okay.
Yeah.
All right. So, is there any place that we could put the gun safely? We can put it up higher.
Yeah, that one might work. Yeah.
Okay. All right. So, you know, when speaking about safety steps, maybe the next step would be to, you know, talk with your partner, asking him if he can put the gun in a different area. Or also talking about long term, you know, getting it safe for that gun and having it locked away so the kids don't have access with it.
Okay. Yeah, I'll keep a lookout for a safe. We just kind of, town is a little bit away. We just been kind of looking at the flea market. So if I come across something, then maybe that'll help with the situation.
Okay.
But
so we can write that step in for the gun right here. Okay. So now you want to look at with your grandma and her pills. So you were saying that grandma doesn't have them locked away, is that correct?
No. Well, sometimes like she'll just kind of leave it out. So we never know where grandma's gonna leave her pills.
Okay. So what we want to do is, you know, keep those pills in a safe place so that the kids don't get access to it. Would that be something that you would want to do?
Yeah, I could try that. I feel a little bit nervous about that, but maybe, I mean, if you wanted to come by to help me, that would be nice.
Yeah.
So you're welcome to come by whenever I need to have that conversation with grandma.
Yeah, it'd be good to build that communication with her, and I think she'll be understanding with that, just for the safety of yourself and the kids as well.
Yeah, I don't want grandma to yell at me, so if you're there, I'll help.
So now that we completed the safety plan, this is a resource you can keep somewhere where you can have access to it when you need it. One suggestion I have made before was that you can have it on your refrigerator if you want to do that, if you're comfortable with that. You can also keep it in your top drawer if you want to do that as well. So those are just some suggestions where you can keep your safety plan. And just as a reminder, I will be following up with you in the next couple of weeks just to check on your well-being as well as to see if you want to make any changes to the safety plan. Okay?
Okay.
So when would be a good time to do that? We can do it in person or we can do it over a phone call.
You can reach me by my phone. I would say next Thursday after 4 p.m.
Oh, okay, that sounds great. I'll schedule that in. Okay. You're supposed to stand in front of it. All right.
Good.
How was that?
It was good.
Okay.
Nice job.
Do a whole run through, Scooty.
Yeah, no, you did a good job.
Oh, that's